What is ketosis? In normal metabolism, your body primarily uses carbohydrates for energy. Ketosis is a metabolic state where your body primarily burns fat for energy instead of carbohydrates. When carbohydrate intake is significantly reduced, typically below 50 grams per day, the body doesn't have enough glucose for energy. This triggers a shift in metabolism where the liver begins converting fat into ketone bodies. Ketones serve as an alternative fuel source for the brain, muscles, and other tissues. This state is what defines ketosis, the presence of elevated ketone levels in the blood. Blood ketone levels between 0.5 and 3.0 millimoles per liter are considered nutritional ketosis. Ketosis is therefore a natural metabolic state characterized by fat-derived ketones replacing glucose as the primary energy source for your body. The body transitions to ketosis through several distinct phases. This metabolic shift typically unfolds over a 5-day period, though the timing varies by individual. The process begins with glycogen depletion. When carbohydrate intake drops below 50 grams per day, your body first uses up stored glucose in the liver and muscles. As glycogen stores diminish over the first 24 to 48 hours, insulin levels begin to drop significantly. The falling insulin levels signal your body to begin breaking down fat cells for energy, releasing fatty acids into the bloodstream. The liver then converts these fatty acids into ketone bodies, which become an alternative fuel source for your brain and body. During this transitional period, many people experience what's known as the keto flu, temporary symptoms that occur as the body adapts to using ketones instead of glucose. These symptoms typically peak around days 3 to 4 and resolve as the body becomes more efficient at producing and utilizing ketones. By day 5, most people have fully transitioned to ketosis, with the body now primarily running on fat for fuel. Fat metabolism in ketosis involves several important processes. When in ketosis, the body becomes highly efficient at mobilizing fatty acids from fat tissue. These fatty acids travel through the bloodstream to the liver. In the liver, fatty acids undergo beta-oxidation, breaking down into acetyl-CoA molecules. When there's an abundance of acetyl-CoA but limited carbohydrates, the liver converts these molecules into 3 types of ketone bodies. These ketone bodies are acetoacetate, β-hydroxybutyrate, and acetone. These ketones then enter the bloodstream and provide energy to cells throughout the body. The brain, which normally relies heavily on glucose, can efficiently use ketones for energy during ketosis. Insulin plays a crucial role in ketosis, acting as a key regulator of fat metabolism. When carbohydrate intake is high, insulin levels rise to help cells absorb glucose and store excess as fat. High insulin levels signal cells to take in glucose and inhibit fat breakdown, preventing ketone production. Conversely, when carbohydrate intake is low, insulin levels drop significantly. This low insulin state allows for increased lipolysis or fat breakdown and activates hormone-sensitive lipase. The reduced insulin also enables the liver enzymes necessary for ketone production to become more active. This low insulin environment is the key biochemical state that enables ketosis to occur. In summary, insulin is the primary regulator that determines whether your body stores fat or burns it for energy through ketone production. The brain's ability to use ketones as fuel is one of the most remarkable aspects of ketosis. While the brain typically relies on glucose for energy, during ketosis, it can switch to using ketones for up to 70% of its energy needs. The primary ketone body, beta-hydroxybutyrate, or BHB, can efficiently cross the blood-brain barrier to fuel neurons. Ketones provide a remarkably efficient energy source for the brain. They can fulfill up to 70% of the brain's energy requirements, providing clean and efficient fuel for neurons. One key difference between ketones and glucose is energy stability. While glucose metabolism often causes energy fluctuations, ketones provide a steady, consistent energy supply to the brain. Many people report improved mental clarity and focus during ketosis. This may be due to the stable energy supply that ketones provide to the brain, resulting in improved concentration, reduced mental fatigue, and more consistent cognitive performance. Let's examine the important differences between nutritional ketosis and diabetic ketoacidosis. In nutritional ketosis, blood ketone levels typically range between zero point 0.5 and 3 millimoles per liter, which is a controlled, safe metabolic state. In contrast, ketoacidosis is a dangerous condition where ketone levels can exceed 20 millimoles per liter, causing the blood to become acidic. In nutritional ketosis, insulin levels are low but sufficient to regulate ketone production effectively. In ketoacidosis, there's a severe insulin deficiency leading to uncontrolled and dangerous ketone production. Nutritional ketosis maintains normal blood pH within the healthy range, typically around 7.35. In ketoacidosis, blood pH drops significantly as the blood becomes acidic, which is what makes this condition so dangerous and requires immediate medical attention. Nutritional ketosis is generally considered safe for most healthy individuals and doesn't require medical intervention. Ketoacidosis, however, is a serious medical emergency that primarily affects people with type 1 diabetes and requires immediate treatment to prevent life-threatening complications. The key distinction is that ketosis is a controlled metabolic state, while ketoacidosis is a dangerous medical condition requiring immediate attention. Protein plays a crucial role in ketosis, requiring careful balance to maintain this metabolic state. Finding the right protein balance is essential for successful ketosis. Too little protein can lead to muscle loss, while too much can potentially interrupt ketosis. While carbohydrates have the greatest impact on insulin levels, protein also stimulates insulin release, though to a lesser degree. This insulin response can potentially interrupt ketosis if protein is consumed in excess, as insulin suppresses ketone production. Additionally, through a process called gluconeogenesis, the body can convert certain amino acids from protein into glucose. This conversion can raise blood glucose levels and potentially reduce ketone production if protein intake is excessive. Despite these concerns, protein remains essential for preserving muscle mass during fat loss when following a ketogenic diet. Most ketogenic approaches recommend moderate protein intake, typically between 0.6 and 1.0 grams per pound of lean body mass. This range helps maintain muscle mass while allowing the body to remain in ketosis. Finding your personal optimal protein intake may require some experimentation and monitoring. The longer someone remains in ketosis, the more efficient their body becomes at utilizing ketones. This process of keto adaptation typically takes 2 to 6 weeks. During this adaptation period, enzymes involved in fat metabolism significantly increase. The liver upregulates key enzymes like beta-oxidation enzymes and those involved in ketone production. The body becomes increasingly adept at producing and utilizing ketones for energy, transforming from primarily using glucose to effectively using fat-derived ketone bodies. Muscles develop more mitochondria to process fatty acids directly. This adaptation allows muscle tissue to derive more energy directly from fat, reducing the need for glycogen. Athletic performance often declines initially when starting ketosis. However, as adaptation progresses, performance typically returns to baseline or even improves beyond previous levels. As the body adapts to ketosis, it becomes more efficient at preserving glucose for tissues that absolutely require it, such as certain parts of the brain, red blood cells, and kidneys. Ketosis provides steady energy levels without the crashes associated with carbohydrate metabolism. Ketogenic diets have been used for decades to manage epilepsy, with research showing significant reduction in seizures for many patients. Emerging research suggests potential benefits for neurodegenerative conditions like Alzheimer's and Parkinson's disease, as ketones may provide alternative fuel for brain cells and offer neuroprotective effects. The anti-inflammatory effects of ketones may help with various inflammatory conditions, reducing markers of inflammation throughout the body. Ketosis appears to improve insulin sensitivity and may be beneficial for managing type 2 diabetes and metabolic syndrome, helping to regulate blood sugar levels and reduce insulin requirements. Ketosis offers numerous potential benefits beyond weight loss. from steady energy levels to improvements in epilepsy, neurodegenerative conditions, inflammation, and metabolic health.